Hello, I'm Dr. Robert Bednarczyk. I'm an associate professor in a school of public health, and my main focus areas are in the areas of global health and epidemiology. And my work is really focused in the areas around understanding vaccine uptake, vaccine acceptance, trying to develop interventions to improve vaccine uptake for the better prevention of infectious diseases. My journey into public health is a little bit of a circuitous one. I actually started off as an undergraduate biochemistry and molecular biology major. That's what my undergraduate degree is in. And after 7 years of doing laboratory work, about 3.5 of those were spent doing actual bench chemistry, and about 3.5 of those were spent doing lab systems validation. So I would go around to companies that were setting up large networked laboratory systems and make sure that they worked the way that they were supposed to, so that all of the data would be applicable if companies were going to be submitting approval documents to the FDA for drugs and for things like that, so that all lab testing was done properly. After a few years of that, I grew a little tired of working in a laboratory, but I had always been interested in public health and I had always been interested in epidemiology. And that started from my time in undergraduate when I was studying classes like microbiology and immunology and molecular biology, but I was also reading books like The Coming Plague and The Hot Zone and these sort of popular science books that really introduced me to the idea of public health, introduced me to the idea of epidemiology, introduced me to the complex web of things that lead to disease outbreaks. And I always knew at some point that I was going to study epidemiology. It just took a little while for me to get there. So in my graduate school days, I started off with getting a master's in epidemiology and then followed that up with a PhD in epidemiology. And my interest in vaccines really came from my interest in infectious diseases in general. Again, that background that I had in immunology and microbiology really spurred a lot of that on. So as I started narrowing my career path in public health, the natural evolution was to move towards issues around infectious diseases and vaccines. And during that time, that was when the human papillomavirus or HPV vaccine was first licensed and recommended for use in the US. And I'd always been interested in these more complex diseases. So an infection that can cause cancer, for example. So I naturally gravitated towards moving into working with HPV vaccine. I do work across the entire spectrum of vaccines, across the entire life cycle of vaccines, but HPV really is one of the main passions that I have. Most of the work that I do really encompasses all aspects of public health. I will try to understand who is getting vaccines and who is not, and the reasons for that through survey methods, through qualitative interviews. But we'll also do big data analysis using large publicly available data sets, using large data registries and repositories. But I also develop interventions to try to improve understanding about vaccines and to try to help dispel some of the myths and misperceptions about them, to try to improve vaccine uptake, and we test those in clinical trials. And I also do a lot of work in the area around vaccine policy and understanding how data is used to inform policy. So that broad scope of work that I do in the area of public health really leads me down the path to start calling myself a preventionist. There's a lot of people who might say, well, I'm an infectious disease epidemiologist, or I'm a cancer epidemiologist, or I study the impacts on policy. But the work that I do really cuts across all of those. HPV is a virus that can cause cancer. So using a vaccine to prevent those infections and prevent those cancers, and understanding the policy landscape that can impact how these vaccines are being used, what the regulations and requirements around these vaccines are, while also developing behavioral interventions, really crosses across infectious disease epidemiology and cancer epidemiology and vaccine epidemiology and policy and behavioral science and health promotion. And I think that that broad look at all of these issues, that all-encompassing look across the whole spectrum of what we can do to try to prevent disease really is a hallmark to the way that I like to think about what I do. And it's a hallmark of the way that I teach as well. I take a very integrated approach to teaching students on how we can better understand vaccines and the diseases that they prevent, as well as how we can use data and evidence for public health decision making and public health recommendations and how those can be implemented. So this seeming lack of focus actually serves me really well because I'm able to discuss topics with a wide variety of people. I am able to have good conversations and brainstorm about new ideas and new projects and new research and new teaching that isn't just restricted to people who are working in the area of vaccines. And having that freedom to be able to expand, to be able to think a little bit more broadly, is super useful. Now, that does make it a little bit difficult to stay up on the most current information, to make it a little bit difficult to stay up on the most current methodologies that are out there. But that pushes me. That pushes me to be better, to stay on top of these things, to learn about all of these new techniques and new methods as I move forward in my career, as I move forward in my teaching and my research and my service activities and my public health practice activities. On a day-to-day basis, I don't have a standard day. My work, like I said, is split across policy evaluations and behavioral interventions and preliminary data analysis. So I think really for me, the main thing that I think about on my day-to-day is flexibility. How can I do the things that need to get done? How can I do them well? How can I do them effectively to fit all of these pieces together? And when I look at all of the experiences that I've had, it's really helped make me a good public health professional, a good researcher, a good teacher, because I'm able to pull information from all of these different areas to try to get a better understanding of how we can best prevent disease. And I think one of the biggest pieces of advice that I have for students is to be open to new topics, to be open to new experiences, and to really recognize that sometimes those situations that come up that you just may not ever expect to lead you somewhere can open a tremendous amount of doors. I've had so many wonderful opportunities working with leaders in this field, working with high-level staff at state health departments and schools of public health that have opened doors, that have made connections, that have led me down paths that I hadn't previously thought about or previously planned to try to follow. But I left myself open to all of those, and it's made me very successful. But it's also given me a good view on how we need to be willing to work across these topic areas. We need to be willing to break down these silos that oftentimes we put ourselves in. So I think if I have one piece of advice, it is to really embrace flexibility, embrace uncertainty, and recognize that the skills that you learn are going to be transferable. And if you find a new topic area, if you find something new that is of interest to you, chances are there's going to be people around you that are going to be interested in that topic, and just have a discussion, talk with people about that, find out why they're interested in those topics. And that may help spur some ideas. Even if you don't pursue that as your own direction, it may help you round out your thinking a little bit more. So in general, I think the career paths in public health are just so tremendous. They offer up so many opportunities if you're willing to take them and if you're willing to step outside of comfort zones and think outside the box a little bit, because we are living in an ever-changing and ever-expanding world. I know for me, I have worked through numerous infectious disease pandemics, the 2009 H1N1 influenza pandemic, and most recently the COVID-19 pandemic. And that's changed a lot of my perceptions on how we need to have conversations with people about the importance of prevention, the importance of vaccines, the importance of taking care of themselves. So while I don't wish you a pandemic to have to work through, I do think that being willing to step into those situations when they arise, and we see this all of the time with new emerging information in public health, having that openness to learn and to pivot is going to serve you so well. But find that passion, find that thing that you're really interested in and take that and follow it. But know that if that leads you down some paths that start to veer a little bit from what you were thinking before, that's okay. I've had a lot of changes in my focus areas, and I'm grateful and happy for all of them. So thank you very much for listening, and I hope that this helps give a little bit of guidance around the things that you're thinking about as you're exploring careers in public health.